Hey guys, hey Coach Hannah here. Me and my girl Krista are doing take two at trying to do a joint live. We have such a great conversation. We're so excited to share with you guys. And if you were part of the fun yesterday, I think I went live 4 separate times and tried to get Krista to join me, and we're somehow not clicking. So we're gonna try it again because yesterday didn't go so well. So I see Krista join the meeting. So what we're gonna do is invite her instead of having her request. We're gonna just try it a little bit in a different way because yesterday was just so exciting. We just wanted to carry it over into today. So let's see if I can invite Krista here because clearly yesterday went super duper well. Okay, so here we go. Send request. Crossed, toes crossed that Krista is going to join this meeting. We're going to have the best conversation ever, rock your world, and tell you why we are the right coaches to get you what you want. Oh my God.
Hello, friend. Yay! It worked.
Those of you that missed yesterday, this is a big deal because this
is huge.
Yesterday, apparently, like now we can only see my mouth and like a talking mouth up here. Usually, like when I'm on the bottom screen, so I'm like hunched over. Okay,
let's see if we can.
I feel like I want to like sink.
There we go.
There, but totally fine. How are you today?
I'm good. How are you? I'm so happy that this worked.
I know. I'm so stoked. So stoked.
Yes.
Instagram's been a little glitchy from what people have been saying. And so
yes, I had someone say the same to me.
Yeah. And just so everyone knows, this is Krista. This is what she looks like even after she works out.
No, oh my gosh, no.
Like airbrushed and like this beautiful hair. And I was like, look at you. Where are you getting ready to go? And she was like, oh, I just finished my workout. I'm like, you after a workout?
But this is what's funny though, is all the sweat, it lives like back here. So you can't see it. It's all like back here after I work out.
I sweat in my sleep and I wake up with ringlets. I'm like, I don't even have curly hair. What was I doing? I know. So I literally yesterday prepared to not look like terrible because I knew I was going to be doing this live with you.
Well, you look lovely today.
I'm literally straightening my hair again because Krista is going to show up and be looking so fabulous.
Well, today, I just said this on my stories. I get to get my gray covered up today. I'm very excited.
What good grief. Oh my God.
Oh no, really. No, well, I have a magic root spray that like gets me through, but trust me, it's in here. I've been gray. I said this. I've been gray since I was 25. My sweet grandma. Oh yeah. She passed it on to mom and I. So we've been both like gray since 25. So
interesting. So I'm a
gotta stay on it.
I just highlight it. But I really had to laugh is I discovered during the pandemic, like who doesn't love a good dry shampoo? But because I'm really blonde, yes. I can just blast the shit out of my roots, and it just kind of so basically the whiter my roots look, the better it looks, which is fine. So like everyone who had this like beautiful line of like the COVID thing just got the best of them.
Yes.
Mine grew in. My hairdresser was even making fun of me. She's like, yours grew in just a dark blonde. You're a blonde hair person.
Yeah. Yeah.
So the dark blonde that grew in was just dark enough where there was clearly a transition, and it just looked like my hair was greasy. So I'm like, everyone else was in COVID. Clearly has a hard line because COVID got the best of you. It just
it did.
Watch my hair for 3 months because it looked like a grease slick, like going down the back. So in the hairdresser, like it doesn't even look like you had a grow out. It just looks like you haven't washed your hair. I'm like, that's nice. Thank you. I did.
Well, I have a great colorist, and I actually reached out to him during COVID because I was like, I have to do something. Like I don't have enough spray root cover to help me. And he was and I will not go into the drugstore and try to like do something fancy on my own. I can't do that. So he actually said, okay, go buy this. And I only did like the part, just the part. And then it was
just gotta make yourself feel good.
It does. It makes you feel better. It makes you feel better. Oh, I'm so excited that this is working.
So to bring everyone up to speed. So Chris and I started a dialogue. We met doing a continuing education course, learning a little bit. I'm like hunched over just so you can literally see my posture. Anywho. Excuse me.
The orthopedic physical therapy.
Yeah, I'm like posture everyone, but anyway.
Yeah.
But we met doing this hormone course and just like getting better at understanding the inner workings of blood work and hormone and metabolism to just most clients who say nothing works for me. I'm sorry, ladies. Most of you, it's just you have not stuck to anything long enough to actually make it work. I digress.
Yeah, and we say that with love. We say that with love, but it's the truth.
I was that person forever.
So
there are some of you that are doing everything right, literally, and your body is just not responding, and we're wanting to know why. So that's how we met, just kind of digging a little bit deeper. And we started this banter on our unique skill set as healthcare providers, kind of how that lends itself to us being really good at what we do as far as online coaching, because of the things we learned with literally direct patient care and medical training, more so than being comfortable with complex medical conditions. It's more of the character traits you develop. So that's kind of how this dialogue started. So most of you know that are joining, since this is on my page, is I'm an orthopedic physical therapist by trade. I did that for 7-8 years before even starting this online business. So giving you a good back, hip, knee, neck, you name it, no problem. I love it. But then Krista's background is in nursing. So go ahead and introduce yourself so everyone can kind of meet you, since you're new to this.
Yes, since I'm new. Yes. So, so I've been doing online nutrition coaching just actually for this past year. But you okay over there? But yes, I have a background in nursing. I have not practiced in a while just because I'm originally from California. That is where I'm originally licensed. I did some work in the ER out there. And then I moved to Chicago to be with my husband. I know everybody's like, why did you move from California to the Midwest, to the snow? But I did it for love. But so I am licensed. I am licensed here as well. But when I married my husband, I was fortunate enough with him. He had a job that did require him to travel a lot. So we traveled for a bit, and then we wanted to have a family, and I really wanted to be home with my kiddos. But, helping people, that alone is such a passion of mine, and part of it, it really does make up a lot of who I am. And so when I started to, go through my own fitness journey, and then kind of decided, you know what, I really want to be able to help other people. And thankfully my nursing background, and just kind of I will never know everything. And I'm not saying that I know everything about every disease process or anything. Love it, Hannah's on the floor.
It's fine.
Every disease process, but having just that basic foundation of understanding is very beneficial. And like Hannah was saying, we met in this continuing education course that really focused on hormones and metabolism, and just really diving deeper into that and having a better understanding, but definitely having that foundation that I already had was super helpful for me, and is super helpful for me with my clients. So haven't been practicing in a while, but this is kind of the next best thing for me, because it kind of combines my two worlds, like my nursing background and then this passion that I do have for nutrition and fitness and being able to help people. So it really is just kind of like the perfect marriage for me. So
I love that. And it's how you can take what you've done and kind of do a mashup into something you're passionate about to supplement your life in a way that you can still be home with the kiddos, and you just find what works for you. So what do you feel like some of just kind of snowballing off of what you and I had talked about is some of the big things that you feel like are just this? I did this a lot in nursing, and this is what really helps me as an online coach.
Definitely, I think a lot of it comes to looking at the whole picture, because it's not just about, obviously it's not just about food and about working out. Like, you really kind of have to dig deep and ask a lot of questions, and the why behind everything. Like I was always the one in class at why. Why? That was always me. So I really do, and I ask a lot of questions to my clients, and part of that is to give me a better understanding of who they are, where they've come from, what situation, what things have they dealt with in the past. Like, I always will ask about past diagnosis as well as any current ones they have, because it gives me a fuller picture of what their life has looked like and what they have dealt with. For example, like if someone tells me, I used to take birth control. Let's just use that as an example. That's going to matter to me when you stopped taking it. Was it 6 months ago that you stopped taking it, or was it years ago that you stopped taking it? Because then that's going to be a different approach I take. If someone is dealing with any kind of underlying disease process, whether it be, PCOS or blood pressure or cholesterol, or I actually had a client that used to deal with nephrotic syndrome, which is a disorder of the kidneys. And so there can be some protein issues in there. So it just makes my mind go to different places in how I approach people. And then also in terms of how I don't want to say treat them because that's not what I'm doing, but just kind of how I guide them is, you really have to look at it. It's not just like the physical or the physiological factors that play in. And, obviously that's my primary care when I was a nurse, but it's also that, that psychosocial, that mental aspect of it too, that really does play. And it played into a lot of, patients, just their recovery journey and how they were able to go down that path and, and get better. And those kind of things do apply in nutrition and fitness. And does someone have support? What kind of support do they have? What kind of, just like roadblocks, like kind of mental roadblocks do they deal with? So stuff like that.
Yeah.
What about for you?
I love that so much. I can really resonate on, needing to know someone's history. I'm like, especially when I'm on like boarding client calls and kind of giving them a roadmap of how it's going to look to accomplish, like how we are going to get you from feeling so not great in your skin to being like, damn.
Yes.
That's what we're going for. I'm like, I need to know where you were. I need to know where you are. And I need to know where you want to go. It's my job to connect all the dots. I can't connect the dots unless I have all the information. So like, kind of like what you had said is like, when did you stop taking birth control? And I'm like, okay, when did you stop? What kind were you on? Have you had a return? Like you need to really delve deep into those questions because there may be, and like, then you're going like, how's your digestion? Yes. I love to talk about poop. I have clients literally tabbing, like, poop.
Yes, you have to be comfortable to ask the poop question.
Like, if it's TMI, I'm like, let me, but
give it to me. Yes. I was always like,
exactly.
Let me have it.
Bring it on.
Yeah.
And I initially sought out starting to do some personal training when just as a clinician, at least a third of my caseload at any given time was I was fixing an injury that someone said either was made worse or was caused by their personal trainer. And I'm like, what is missing? Because I'm like, I want to bridge the gap. Is like the personal trainer has a great skill set. I now know what they know too, which is great.
Right.
They have the best intentions, but sometimes like they just don't know what they don't know. And I'm like, oh, of course they made it worse. They told you to stretch this. It's clearly coming from a nerve. This is not your hamstring. Like, stop that now.
Yeah.
So it's just being able to apply that clinician knowledge of like, okay, your client wants to lose weight, but they have a like underlying reoccurring like tendinopathy or like this starts bothering them when they start upping their mileage when they run or like, a history of low back pain or they've had a surgery. I'm like, cool, let's do that. Like it's more fun because then everything is customized anyway and you just get to delve into that. But with your medical history, I just have to go on a tangent. This is probably one of my favorite moments ever in a patient eval. I'm looking at this eval. I mean, it's like, like heart conditions. Like, have you ever had a stroke? Do you have seizures? Like, it's just basic intake form. You need to know if they're not, like all the things.
Absolutely.
But I already read his medical history for the big pieces, but you always just verify. You just want to make
always assess. I am always assessing.
And the guy, I'm like, so I'm looking at him, I'm like, so just looking over your medical history, you said no for any cardiac issues. He said, that's correct. And I was like, forgive me for being dense, but I read that 2 years ago, you had a quadruple bypass and a very extensive, like following open heart surgery. I'm like, that seems to be a relevant cardiac surgery. His response was, the doctors fixed it. I don't have a problem anymore. I'm like, that's adorable. You always check yes.
Oh yeah. Well, or even the medications, like you're saying, it's like having just an understanding of what they are. Oh no, I don't have an issue with, no. Have you ever had a problem, cholesterol, blood pressure? No. Well, that's interesting because we've got some ACE inhibitors here. We've got some diuretics. Like, let's go down this path a little bit further.
I know. I was like, well, the medication, like, do you have a thyroid problem? I'm on Synthroid. I'm like, so I don't have a thyroid problem. I'm like, no, you do have a thyroid problem.
No, you do have a thyroid problem.
I'm like, this is fun. It's just, it cracks me up. And so
I know.
Kind of like something Chris and I were talking about when we were just like sharing stories is something that I learned, and it almost sounds bad, but you got to hear me out, is I learned to never trust anyone. And this is coming from a very trusting person. I'm like, you know what? Like, if we're walking down the street and like, I need to share your secret. Sure, I'll tell a stranger. I don't care. I'm a very open, trusting person. But I started, especially as a new clinician, like you were fresh out of school, wet behind the ears. You just want to, you want to save the world.
You want to go.
Presentation, and you are so confident in your exercise program. You are so confident. And they come back and they're like, you made me worse. Instantly, as a new clinician, you were like, oh my God. But you're trying to save face. You're like, let's discuss. So instantly in your brain, you're like, what did I do wrong? I have to change everything. What did I miss? Go into like freak out mode when a few months under your belt, you start to develop the skill set. And what's one I lean on now with when I was in the clinic and now with my clients is I'm like, okay, it's like either like you made me worse, or I think the exercise is irritating it, or like this nutrition plan isn't working. Instead of saying let's adjust, I say in the clinic I'm like,
show me
what you've been doing. Like,
show me.
Exercise
Right.
I think would be basic is like,
yeah,
you lay on your back, you bend your knees, and you lift your butt up like a bridge. You would be shocked what that turns into when people go home. Some people will literally come back and do it laying on their belly. I'm like,
I can
imagine. I'm like, there's a picture of someone laying on their back. Why are you doing it on their stomach? Oh, I don't know.
Why are we flipped?
And so I just learned is like that, like not to just trust at face value. If something is
you always have to dig
about it. Let's reassess. Like, even if like this nutrition program isn't working, I'm like, let's take a look at your log. And I'm like, well, you took the weekend off, and so you were really good for 3 days. Then you had a 4-day bender, and then now you're mad. I'm like, I understand you're not where you would like to be, but let's assess.
Let's assess.
Yeah,
always.
I would just
always
data and making the like objectively being able to make a decision instead of just listening to, oh, it's making you worse. Okay, let's change it. Or
it's easy to have that like
let's drop
knee-jerk reaction. Yeah, exactly.
Drop, let's do this, but you're like, let me take a look first.
Yeah, let's dig
too.
Yes, let's dig. And as frustrated sometimes as they get, it is for your best interest. We are not being pests.
I want this.
Yes, I want it for you. We are not being pests. We are
exactly. It's just because like I mean, you and I have both been on like, and I think that's what makes us better coaches too, is we're not just healthcare providers, but so I mean, we've been a patient before. We have doctors too, but then so like we've been on the receiving end of coaching before. We know what it's like to work with a coach, and it's to be objective with yourself. So you need that person who has that healthcare.
What is that? Providers are the worst patients, and probably coaches are the worst clients.
Oh, because if you think you know everything, but it's taking back and being like, okay, this person genuinely wants to like help me. And I'm turning into a toddler. Like, get better right now.
You can't be objective with yourself always. You can't do it. You have to step aside for sure.
And especially like when someone's like injury is like I've seen it in like, you know, like distance runners who part of their soul is and they get an overuse injury and you literally don't want to, but you have to take it away. Like, I know like it's so hard to not be able to do it, scratch that itch. You're like, you know, I know.
Like I've been there.
Look in the mirror and think, God damn, I've got to get this weight off. Like it's fun when you can say, you know what? I know how frustrated you are because I have felt it. Give me more information.
Been there. Yeah. Give me more.
I'm going to learn it has to be a collaborative relationship. It's not a
That, you know, it's so funny you say that because I literally had that conversation the other day with a client because again, it was that, you know, this is too much food. It was the food conversation that this is too much food. I can't do this. And it really was about, okay, let's have a conversation because I do want this to be a relationship. And I do want this to a certain extent to be a two-way street because I don't want to just sit here and dictate to you, you know, this is what you're going to do. And I don't want to hear what you have to say about it. It really is. And it's building that trust. Cause that was the other thing too. A lot of times, you know, when you're treating patients or you're, you know, helping clients, it really is important to establish that trust because you do build that bond and the relationships. And I still remember some that I had with patients, like that can really make such a difference for someone in their journey and even in their recovery. Like when, you know, in the hospital, like having that bond. And then, you know, when you show up on your shift and they're like, they kind of light up to see you because they know that there's that trust and that safety and having that relationship. I think that makes, and knowing how to do that. Like you can't just jump in that, you know, you have to kind of, we've dealt with all walks of life and you have to kind of approach each one in a different way and really like meet them where they're at too.
Oh, I love it. Yeah, just really reading the audience. And I love it is like, it's learning how to develop that trust organically. It's super fun. Like, and I did that as a clinician. Now I do it with my clients is like half the time, you know, if I was like, you know, halfway into a treatment session, we haven't once even talked about how their neck is doing. Like we're just like, you know, doing exercise review, but we're like, how did the bake sale go with your daughter? Did you be able to bake all 800 cupcakes she signed you up for?
Oh
Or,
yeah. You learn all the grandkids' names.
oh yeah, and like you just get to know people much more than like a name
Yeah.
on your roster. It's fun to get to know them because then that helps you remind them of the why. Why are we
Oh
actually
yeah.
doing this? So I think it's just super fun to, like you said, just get to develop the trust and realize it's a collaborative relationship. And some of I did this in the clinic with patients, and I do it with my clients. I'm like, if I tell you to do something and it doesn't make sense to you, challenge me.
Yes. Ask me
I
why.
tell you why you should be doing it. You should be doing it.
That's the red flag right there.
If I can't tell you why and I just expect you to do it, like that's not a good relationship. And like when I'm onboarding clients now, I'm like, I want you to want to know. So if you just want to be handed a program and execute and you don't really want to learn anything, I am going to waste your time because I want
Oh
you
yeah.
all of it. All
Yeah.
of it. Because I also, especially even like in injury prevention from a physical therapy standpoint, I'm like, if I do my job right, injury wise, or if I do my job right as your weight loss coach and educate you along this process, I am reducing the likelihood of you ever needing to come back to someone for this problem again.
Yeah. The goal is for you to not need me.
Independent. It's
That's
like,
the goal.
you seem lovely, but I really don't want to work with you forever, with all due respect.
I say it with love.
Yeah.
But I don't want you to need me forever.
Like,
right.
Out some point, but we got to teach you how.
Yes. Absolutely.
I
Absolutely.
love it. Something you had brought up when we were talking too was kind of just that ability to have like a collaboration over independence as far as like being able to
yes.
like, let's get you to the ultimate goal. And I might need to lean on some of my mentors or resources or colleagues in this, but like.
And I do. Absolutely.
So I loved how you brought that up when we were talking.
Yeah, no, I mean, as much as, you know, the education that you've had and all the experience you've had and the education I've had and experience I've had, I will never ever know everything. And I'm totally good with it. And I want to keep learning. I think it's important to always be in a state of learning. And I think the second that you think, oh yeah, I got all the answers,
red flag.
like that freaks me out. Red flag. But yes, it's if I don't know the answer, I am 100% comfortable saying, you know what? I don't know the answer to that, but I want to give you the best answer that I can. So I'm going to go find out. Let me dig a little bit deeper. And it's great because we've got mentors to lean on. I've got you to lean on. You know, other coaches I've met, it really is, you know, it really is a collaborative effort. Like you're not just on an island alone, for sure.
I love, that's exactly what you said when we were chatting was, the quote is, I don't know, but let me find out. And I love that so much. And even like when I'm in a patient situation, that is, if you are my healthcare provider, whatever role it is that you're in, if you drop that bomb, if you can tell me to my face, I'm not sure, but let's dig a little bit deeper. Let's find out. You instantly have me for life. I am.
Oh, yeah. And the trust goes up. It's
It's when you just spit out rapid fire questions that I don't start to not trust you. Like when people, you know, I'm sure you get them all the time, like in the DMs, like you post a transformation picture or like something and it's like, how many calories I need to lose weight? How much cardio? It's like these like really just how much, how little, how this. And I'm like, and I know it's annoying.
Not that easy.
Our response is, it depends.
It depends. But it really does. It really does depend.
Number is because it does depend. And I'm not going to
depend
that I know you when I don't. And so it's like when you don't get exactly what you want, but they're leaving the conversation open, that person's probably actually trying to help you. Instead of just saying, go away or not responding, it's like, give me a little bit more information. We're not trying to be difficult. We're genuinely trying to help you.
It genuinely depends.
Or like, buy this macro program and they don't ask you anything, there's no way they're going to get your nutrition or workout program right. No way.
I'm happy to offer up the general, you know, water, move more, sleep, eat some fruits and vegetables. Happy to offer that up. But yes, when we say it depends, truly, it depends. We're not saying it to be difficult.
I'll be like sending a voice memo and I'm just like, you know, it really depends. I just don't know enough about you to give you the answer that you're looking for now. And like, I'll just kind of like throw in there. I'm like, I can feel your eyes rolling now as you're listening to this.
Yeah.
Like, I know.
Insert eye roll.
Yeah, I know what you're looking for. Like, and I don't want to take this too long because I know you have a couple things coming up today. But
my son's got his little speech therapy. Very exciting for Play-Doh and Mr. Potato Head today.
Oh, I want to come. That sounds.
I know, it is fun. It is fun. He has a good time.
One more thing that you brought up that I really loved, it was just of how we've learned as healthcare providers, kind of like how you said, like meet you where you are, is we know the medical terminology and we need to make you understand it. And so, like,
Oh
for
God,
example,
yes.
like I
Yes.
used the word of the day with my husband. I'm like, your kneecap is the patella. And he would take that opportunity to educate me. He goes, no, it's not. It's your kneecapula. Everyone knows that.
Your
Yeah.
kneecapula. Oh
So
my God, that's awesome.
he teaches me anatomy in the wrong way, which is great. But you were talking about just the value of explaining why
Yes.
in a way
Yes.
that who you're talking to can receive it.
Well, and it's even, to go along with that, I think it's so important that, we're never going to, diagnose or, try in any medical way to ever tell anyone what to do. But if we can give them that knowledge that they can then take to go to their doctor and, maybe even ask the question, you start asking why, start questioning why you're either, taking this medication, or should I incorporate this vitamin or supplement or whatever. It's providing that knowledge to our clients that they can then take to educate themselves. And because really, and I'm not trying to harp on healthcare, but you really have to be your own advocate. You really, really have to be your own advocate. And
Oh,
if you have that knowledge and that understanding, and if we can help you in that way to help you kind of feel a little bit more empowered to kind of take charge and really be a part of your plan with your doctor, with us, whatever, that's so valuable to someone, because it's so easy to just, doctor, and I've seen it, you just write a script and move on. And it's like, well, but maybe there's something else that you can do, or maybe you don't have to do that. Maybe you can start with this. It's just, being able to help someone in that way and just give them that understanding and giving them, it's okay to ask why. It's okay. We want you to ask why. And
yeah.
I want you to ask your doctor why.
Yeah, I love that. And it's just explaining, like, I recently had a client who we're getting some blood work and getting her, like our healthcare providers were in the conversation. I'm in the conversation. I'm like, we just need a team looking at all these things. And she recently was like, okay, they want to do like this medication, and that's really all we got. And I'm like, well, what were these values, these values, these values, these values, and these values? And she was like, well, I don't think we tested those. I'm like, well, that's interesting, because that medication aligns with this value. We don't even have it. And so I'm like, what's the dose? What's the long-term implication? She is young. I am. And I'm like, is this a forever thing? Is this a short term? And she's like, I don't want to be on this forever. I'm like, start asking the questions now. I'm like, here's some material. Like, start, like, don't go in guns blazing, because that is the quickest way to like have someone go on the defense, but just say, like, help me understand. And I love being able, like, I love the word you used, empowered, is playing a role to help empower women to take your control back and say, it's okay to want to know more. And like, something that I love that you and I touched on when we were chatting was how it all goes back to just the basic bitch diet, is like, or like the basic bitch, like,
yes, I love it. I love being the basic
detox, all the cardio. And like, I think I had done an IGTV on it. I'm like, why the basic bitch diet isn't working. I'm like, you and your White Claws, listen up. And I'm like, I level with people in words they know. I'm like, okay, I understand that you think you need to eat less than I'm telling you. And I understand that you think you need to do more cardio than I'm telling you. But if it was as simple as eat less and do more cardio, would any woman on the planet ever have trouble losing weight?
No. We all did it. In excess, we all did it.
Yeah,
for a long time.
Oh my gosh.
Longer than I like to admit.
Tell me you've seen the Dr. Rick commercial where he's like, we all see it.
I don't think I've seen that.
We'll have to, I won't go there today. It's worth it.
Okay.
It's great, but
I'm going to have to check it out though.
If everyone is doing the same thing and there's still an obesity epidemic, there's still an issue, maybe following the masses isn't the right way to go.
Yeah. There is a better way.
I'm like, you know what? You go against the grain. Maybe you don't want to fit in, because the stats are, I think at this point, 95% of dieters who lose the weight put it all back on, often more every year. So I'm like, maybe you don't want to be popular in the big group. Maybe you want to be in the 5%. This is where you want to be an outlier.
Be the rebel.
Yeah.
Come over with us and be the rebel. I love it.
Be the one in school with your highlighters and not a lot of friends, hoping to get asked to the dance and no one comes, but you're like, it's fine. It's fine. I don't know.
I love that. This was so much fun, Hannah. I'm so glad we did this. And I'm so glad our technology cooperated.
Finally. So I've been scrolling through. We got a couple people just jumping in saying, hey, so I don't see any specific questions that got asked.
Okay.
So We will do our very best to save this. So at the end of
Yes.
the day, ideally, this is definitely going to save on my page. I'm pretty confident because I've done this before. We're going to try and download it so Krista can save it to her page too.
Yes.
It's as an IGTV. So thank you guys so much for joining. If it saves, those of you that came in late, feel free to watch. It's just kind of two healthcare providers going back and forth on what taught us how to actually be a healthcare provider as an online coach, and why it's just gives us a little bit more of a unique skill set. And if it doesn't save and you did catch it, congratulations.
I know.
Because we're not doing this again.
Maybe another topic, but not this one again.
Exactly. Well, thank you guys so much for watching. Krista.
Yes, thank you, everyone. So great to see you.
All right. Bye.
Bye.